Self-help physical therapy with Bumrungrad. Instructions for patients with hip replacement surgery. After a hip replacement surgery, patients must receive therapy to restore muscles around the hips in order to return back to normal life as soon as possible, with safety and with no complication. Bumrungrad Hospital Physical Therapy Team has some instructions for patients with hip replacement surgery as follows. Patients should follow these practical procedures. Early post-operative symptoms may include pain, swelling, redness, and warmth around the surgery site. Use a cold compress for 15 to 20 minutes at a time every 2 to 3 hours. If the surgical wound has a change in color or has abnormal pain and swelling, consult your physician immediately. While using the gait aid, put your weight on the operated side as your physician recommends. Should exercise regularly. Patients with hip replacement surgery have restrictions and precautions as follows. Do not bend your hips more than 90 degrees. Do not bend over while sitting. Do not sit cross-legged. Do not put on or take off your shoes while your hips are turning inward. As for your daily practical activities, you should follow these instructions. Sleeping. If sleeping face up, put a pillow between the legs to prevent from closing your legs. To sit up. Support yourself up with your hands, then gradually move the non-operated side to the edge of the bed, making sure to keep your legs apart. Then, drop the foot of the non-operated side down to the floor first and support your body with your hands without leaning forward. Slowly lower the leg of the operated side down to the floor. Hold the bed or the walker with both hands to support yourself to stand up. Sitting. Sit on a stable chair with proper height and arm rests. The position of the knees should be lower than the hips. To stand up. Stretch the leg of the operated side forward while putting the weight on the leg of the non-operated side. Use both hands to push yourself up from the chair without leaning your body forward. To pick up an object from the floor, use the pickup stick or kneel the operated side down to pick up an object. To put on and take off shoes. 2 months after the surgery, patients can put the shoes on by themselves. Start off by putting your legs slightly apart, bend the knees, lift up your foot, and put on the shoe. You can also use a short stool or a box to put in front of you for the shoes. Turn your hip out slightly with legs apart and slip into each shoe. For patients who have had hip replacement surgery, the correct and appropriate exercise is definitely a necessity. There are 6 lay-down exercises as follows. Exercise 1. Flex your ankles up and down slowly. Patients can do this position frequently, every 5 to 10 minutes, continuously from after the surgery until fully recovered. Exercise 2. Turn your ankles in and out repeatedly, 5 to 10 times, 3 to 4 times a day. Exercise 3. Raise up your knees and pull your heel toward your hip in a straight line, one side at a time. Make sure your heels are rested on the bed and do not turn your heel inward. Repeat 10 times, 3 to 4 times a day. Exercise 4. Tighten your hip muscles. Hold and count 1 to 5. Repeat 10 times, 3 to 4 times a day. Exercise 5. Spread your legs out to the side, then close them back in. Repeat 10 times, 3 to 4 times a day. Exercise 6. Tighten the frontal thighs and stretch the knees straight out. Hold for 5 to 10 seconds. Repeat 10 times, 3 to 4 times a day. There are 3 standing exercises as follows. Exercise 1. Hold the back of a chair for stability and stretch the operated side leg back while keeping your back straight. Hold and count 1 to 3, then back to the original position. Repeat 10 times, 3 to 4 times a day. Exercise 2. Bend the knees and lift the operated side leg up slowly to the waist level. Hold and count 1 to 3, then back to the original position. Repeat 10 times, 3 to 4 times a day. Exercise 3. Spread your legs out slowly without bending your knees or hips and keep your body straight. Hold and count 1 to 3, then close your legs back in. Repeat 10 times, 3 to 4 times a day. This exercise program can be altered according to the patient's condition. Stop exercising immediately if you feel pain and fatigue. If you have any questions, please consult your physician and your physical therapist.